apologize for that. I don't know what happened, but okay. We'll look into it, Danielle, a little later.
Yes.
It is what it is.
Okay.
So
Okay.
Giovanna, I guess I could jump in, or was there something you were trying to tell us before we got the boot?
I forgot.
Okay.
I forgot.
Genevieve was talking when it cut out.
Oh, okay.
It was just about sharing information. It was just about sharing information and really reaching out to each other and knowing what we are doing, so that if you are struggling with something, then that's what it was. Because Genevieve was talking about her youth, and I know that Margaret and Kathy are really focusing a lot of efforts with their youth. So if there is any questions, or you want to explore a little bit more, absolutely, reach out to each other. Genevieve, I would also encourage you, the Governor's Prevention Partnership does also have youth, and they work with their youth. So potentially maybe you could reach out to them and ask them what they're doing. They're one of our resource links that are, they receive prevention dollars from DEMAS as well. So that's another resource that you may want to reach out to when you want to.
Thank you. Yeah, our issue really is the way our youth clubs have been structured in the past. They're very student driven, and the kids like to plan a lot of things together, and they've tried planning things virtually, but they fizzle out pretty quickly. The kids just don't have the energy to get back on Zoom and do an out of school club on Zoom. So they'll brainstorm the idea, but the follow through is not there, which I can't blame them. So, they're struggling with the transition. Our curriculum based programs are going gangbusters. They love that, where all they have to do is show up. But the stuff where they have to be a leader, they just don't. It was a tough fall in Wilton, and kids are just tired.
Mm-hmm. Well, you guys had a rough 2020. Well, we all have, but you guys definitely at the end got hit hard.
Yeah, exactly.
This is Sonia Stack. Hi from Weston, ADAP of Weston. I think a couple of things to add on to that. So I love this getting together because I've been scribbling notes furiously on what everybody has been doing. In Weston, we are also working on sort of a comprehensive resource guide that will have a section on vaping, and the intent is to do it both virtually and a printed guide. We're still trying to figure out how we would actually distribute that. The kids, our youth group is still meeting. They are meeting outside. There's one of our board members' homes in the backyard, distanced, bundled up. The youth groups, typically we would offer, pizza and water, and that doesn't happen, but our facilitator still comes. We have asked him to speak about vaping. So the kids, they get pretty good attendance. It is only once a month, but it is live, and they will keep going. They are totally down to just bundle up and go. I was really interested to hear the towns. I guess I saw New Canaan, the towns where you have that heavy youth engagement. I'm just curious to know how you are actually, when the students are designing the curriculum or the pizza box designs and things like that, is that the LPC's youth group, and then they're working with some sort of faculty mentor, or I would just love a little clarity on how you're getting such heavy involvement from the kids, because that's great.
So in that particular instance with the pizza boxes, I was in touch with the health department at New Canaan High School. We're fortunate enough to have our SROs, our middle school SRO and our high school SRO sit on our coalition. So our high school SRO on our coalition meeting, when we were talking about how we can pull more youth in, just especially given COVID, he went to the health department and said, hey, told them our story. And then I reached out to the health department. So he basically connected us. And now that we're connected, they're happy to work with us with whatever they can to help us keep this initiative going and spread the word, because obviously, as we know, teens learning from teens are very important.
Yep.
So I'm just kind of in constant contact with the health department there, in terms of seeing how we can work together to continue.
Okay, yeah, and I think it was Stanford also talked about, Terry talked about the kids who are working with Ingrid Gillespie around designing that, the resources in the curriculum. So you have somebody who's knowledgeable who can guide the students. Is that right?
Yeah.
Sorry, I think that the question.
Yes. Well, and that for New Canaan, that's part of our, like I said, that's part of their curriculum. So yes, you have the teachers involved in that in the department. So they're guiding them to say, we gave them guidelines because of the printing. There were guidelines, they can only use certain colors, but basically it was free canvas for you through your high school curriculum to develop something that was to you if you were looking at that.
Great, thank you. Yeah, so Weston's been pretty limited. Another piece, we were just in a meeting, the other board member and I, who are pretty active as far as the regional work with our youth services director, just on how to improve engagement within the LPC. It's kind of essentially right now, this past year with quarantine, it's pretty much been 2 people. And it's very difficult to get, it's really, I'm encouraged to hear all the work that all of your other, all of the other LPCs are doing. But for 2 people kind of connecting with our youth services director, we're trying to partner, but we haven't had a lot of success in actually putting good information out. So I'm hoping to kind of cull through after this meeting and sort of kind of select what we actually think could be doable with our limited human capital.
So Sonia, this Kath. So I've been doing a lot of capacity building with Fairfield Cares this year.
Yep.
And so one of my goals has been to get at least one representative from all the youth serving organizations to attend the coalition meetings. And I've been fairly successful. We got everybody but the Y has showed up. So we've got Boys and Girls Club, we've got the Rec Center. Obviously we've always had really good school representation, but my hope was to really get everybody who's working with youth, particularly in an after school or off school hours time frame, to be the planning of activities and outreach and substance prevention planning.
Okay.
So still having some, not quite as much success as I'd like. The other is trying to engage like the juvenile review board involved in the coalition. Just trying to get all those sector representations.
Yep.
That's a lot of work.
Yeah,
And it does involve, just sitting down and having some one-on-one conversations, doing that 10 cups of coffee kind of an idea with people, so that they have a sense of what your group is all about. And one way to hook them in is to say, we need more community involvement so we can decide on what our goals are as a community. And it takes more than just 2 of us to decide that.
Yeah.
So that may be one way. I'm happy to talk to offline.
Okay, thanks, Kathy.
Sonia, I would also say, I think, you and I you're all volunteer led, and Wilton Youth Council's mostly volunteers, and I'm only about 15 hours a week running all of our programs. So this is just one little part of what we do. And we just have to remember that we can't compare ourselves too directly to some of the other groups at the table here that are much bigger and have full-time staff members and big grants, and we have little grants and little
understood, right? I mean, this is
we have
no, keeping it all.
what we can do, right? Like our programs are going to be smaller than some of these other groups. So I just want to encourage you not to be discouraged by,
Thank you.
I don't think we can compare ourselves directly.
No, that's true. I mean, we don't, you know, when I hear flavored ban ordinance, we don't have any commercial base in town that actually distributes that. So it's very different. You're right. It's not apples to apples. And this whole past year has been all about keeping things in perspective. So thank you for that reminder. But still, a lot of great ideas coming out. So that's it for
And
Weston.
thank you, Sonia and Genevieve, for saying that for us in Monroe too. I appreciate that.
Well, and I also think sometimes, less is more, right? It's like you could do a few things and just do them really well, right? And they make such an impact. And sometimes I think sometimes we can lose sight of, let's do this, this, and this. There's so many great ideas, but if you could choose maybe one or two things that speak to you, even if it's those two people, and discuss it and say, all right, let's take this and roll with it. And what can we do with it? That's just going to make a difference, or, hit home to people. So.
Right. Yeah. And the big thing I think that we have been really excited about is that the students, the kids are actually getting that FaceTime with the facilitator who they know and who they open up to, and just
Oh, I want to hang out with Tim Walsh.
That piece is really good for them. And the kids the two students, the high school students who are on our board and attend our meetings will say that it's just great not to be staring at a screen. So anyway, that's it for us.
Well, and I think that's a big win right there, right? What you just said. I mean, huge that you have those two students and they're super happy and they have that interaction.
Yep.
Work.
And Sonia, too, you have Laura Cleary, excuse me, that is there as well, where she knows prevention. She worked in the prevention field before. Yes. And she'll be able to, at least, I know she's part of or at least attends the board meetings. And she's just another resource, right? Yeah. But again, it's what's within your capacity, right? You can't do more.
Right. No, and we are in regular contact with Laura. She's amazing. So we kind of, it's not really, it's two and Laura. Mm-hmm. Anyway, but thank you.
Yeah. Thank you all for commenting. It's nice to have this community of support, right, within ourselves, because we are doing so many things and everyone is at different levels, and rightfully so. Some people have a lot more money to be able to do things and others don't, and it doesn't matter about that. It's about what are you doing within your community that is making a difference, right? So comments, supportive comments, caring comments are always appreciative, especially during these crazy times. Crazy.
Giovanna, one other point, and I don't know if people are aware, but for those of us who do have federal dollars, anything we produce with our grant money is available to anyone else. I mean, we share because we do, but by law, anything that we produce with grant money should be available to other people. So look for things that other coalitions are doing, because you don't have to. A lot of us are it always frustrates me that we have all these coalitions kind of doing the same thing and recreating the wheel every time, like how many various campaigns that are like shades of difference. So, it's kind of exciting what's gone on with the mentioned prevention campaign, because it's allowed a bunch of us to kind of pool our money. So when 8 of us throw in our $2,000, we're getting what would cost $16,000 or $18,000 normally. But that stuff's available once it's done, if it's been used, for those of us who have federal dollars.
Yeah. And for those that don't know who has federal dollars, can all of our DFC funders just raise their hand so that people know? So we have Trumbull, we have Greenwich, Bridgeport, Stratford, Norwalk. Well, Positive Directions is out of Westport, but the funds are for Norwalk. And Where's Tammy? Tammy here? Not Tammy Julian, Tammy Trojanowski. Now there's two Tammys. And then Stratford also has DFC funds.
Can you
So
guys
that's
hear me?
always, go ahead, sorry, go ahead.
I figured I would go next because I can report on Norwalk, but Norwalk since Diamond left, and also Westport. But I figured I'd piggyback on what Melissa just said. I know we're talking about vaping, but the Mention Prevention campaign is an alcohol campaign, and so we're now doing it in Fairfield and Norwalk. And that started with the towns that Melissa just mentioned, Trumbull, Stratford, Fairfield, Milford. And we also in Norwalk are doing liquor stickers, which we got from Southington Steps. So those are two Connecticut developed alcohol campaigns that, you know, you can just, like the liquor stickers, like you just pay the graphic designer like $200 to throw your logo on there, and then you just pay for the printing and the distribution. So we're in Norwalk, we're doing both of those things for alcohol because it's like a 1-2 campaign. Like, here, parents, put your sticker over the top of your unopened, unfinished bottle to kind of lock up your liquor. And also, here's your information in your curbside delivery boxes. But so now I'm going to pivot back to vaping. So just in terms of vaping, in Westport, it's been interesting because people don't really want to talk about vaping too much. They want to talk about alcohol, and that's what we've been doing mostly this year, and doing some data collection, focus groups and stuff. We actually have the Teen Awareness Group, which is a 501c3 run totally by kids in Westport, and they're going to be kind of leading the vaping activities. So there have been discussions at that level. I did, as Giovanna mentioned, I did a vaping presentation to the coalition, and we are working on 2 ways to get information out to the community right now. So there's going to be a series of videos based on the Risky Behaviors Forum that Westport used to do, and hopefully also on the Freshman Forum from Trumbull that went online. And we've been having a whole series of conversations to develop a health and wellness newsletter. Just had a call this morning that we have approval to send that out through the PTAs to all parents in the district. And it's going to be a specific newsletter that will be largely driven by prevention, but it will be health and wellness in general. So that's what's happening in Westport. And in Norwalk, we've done some focus groups in health classes at the high school level, and have kids developing content around vaping, marijuana, and opioids that will all be on the new Norwalk Partnership website, including making videos and things like that, having a video contest. What was I going to say there? So, you know, I just want to say, respond to what Genevieve said about Wilton. The teens are so tired and so done, and they, you know, like, I've gone into classrooms and talked to them, and they'll all express how much they want connections with other people, but then they are too tired to join the meetings. And Norwalk is having a series of teen town halls that are run by teens once a month on different topics. And they're getting such small numbers of kids there. But then if you're in the class with them and say, this is the topic, they're all fascinated, but they don't have the wherewithal. So we started a teen group, and they pretty much were like, here are a bunch of ideas, and here's why we don't have the energy to do them, and here's why we don't think people will come to them. So if you can just do something, we will possibly come to it. But can it please be outside, like Sonia said? So there is just a lot of fatigue around this stuff, and we're trying to figure out how to pivot. So in terms of pivoting in Norwalk, we do have the Smart Recovery teen group that has been meeting online since March. So that's available to anyone from any town, right? It's not Norwalk specific. It just used to be held in Norwalk. I think we're going to start having that go back live. And I just want to mention, because of the teen fatigue and the teen mental health issues, that turningpointct.org, if I can just throw in this plug here, you guys know turningpointct.org is the statewide youth and young adult developed online resource for peer support, right? So it's information, kids can upload stuff, they can read other kids' stuff. It's all done by teens and young adults. I've been the project director from the beginning. It just moved over here to Positive Directions with us. And we're actually negotiating with Demas right now. So we're going to start having like over the holidays, they offered 4 different just drop-in social, meet other kids or vent or whatever you need events for teens in the state. And we're going to start offering live peer support hours where kids can just talk to a trained young adult with lived experience with mental health or addiction and get live peer support. And they're trained recovery support specialists.
Well, hi everyone, it's Tammy from Stratford. You know, Margaret, what you were talking about, what we're seeing is also that sort of the virtual fatigue, but we also, our kids are desperate for any kind of service. So for example, our community center, one of their big fundraisers is they sell Christmas trees and they ask for volunteers to be outside to staff the Christmas, and they had more kids than they knew what to do with. And so we've been trying to think about what are additional outdoor sort of service activities. And I know that's not exactly, you know, head-on vape prevention, but I think wherever we can get kids connected in a safe way. So we're actually going to be doing a digital take back in our community. So we'll be engaging kids to be outside at to take the devices out of people's trunks on this take back day. So just kind of another thought to possibly engage kids. Anything that I know our kids are just desperate to do service because all, you know, the library's not, you know, there's some things they can do at the library, but not like what they used to. So a lot of their normal service opportunities are just not there for them right now. So a couple other things here in Stratford, it's kind of similar to what you've already heard, so I'll be brief. We're also, as Melissa said, part of the mentioned prevention, and what's fortunate for us is that we have neighbors on 2 sides of our community that are also, so we have Trumbull and Milford. So I feel like that strengthens the initiative across communities because people don't, you know, just stay in their own town, right? We're all over the place. And then also we did a paid digital ad campaign in the Connecticut Post about the data around COVID and vaping. So and it was interesting where it would pop up when I would be reading my paper digitally. It would be like in COVID articles. It always kind of surprised me. Like, oh, there it is. So that was for me kind of fun because sometimes you just never see some of that stuff that gets out there. And then we're also partnering on the February presentation that Melissa mentioned. And then we had done, and I put it in the chat, when we put up signage around no smoking, no vaping on school grounds, we put them up, that's where we started at our football fields. And our public works department made those signs at no cost. So they're not, you know, fancy, if you will. They're pretty straightforward, but it's the message, right? It was, and then we had, the kids were able to get the zip ties and just go hang them on the fences. So I don't know if in other communities, if your public works departments have the sign making, maybe they would make some signs for you as well. So which kind of reminded me that our signs are a few years old, so they probably need to be replaced, some of them. So nice to see everybody. That's the report from me.
Who's next? Did everybody go, Daniela?
I think that may have been everyone.
Oh, wonderful.
You know, I just had one last thought. It occurred to me, I meant to say this earlier. So, you know, in Stratford, we've been lucky to, you know, have funding and to have a really long history of youth engagement. And I think it was because, you know, of our Youth Service Bureau roots that we have had that for years and years and years, which makes it like so easy to continue it. But I will tell you that, you know, we've had some staff transition, and that really has a big impact on youth engagement. And so even though I have this history and we've done some great things over the years, I'm really worried because of you know, there isn't, you know, it's going to be somebody new with our kids yet again coming in, having to build the relationship. And so it's an ongoing process. Even if you do have a lot of resources, it still requires you to be very intentional and hopefully have some consistency with the adults that are working with the kids, because I think it's hard when there's a lot of change.
Yeah.
All right, if that's all, we'll move on to the next item on the agenda. Next will be the,
Daniela,
yes.
sorry. Could we talk though for a minute about the whole idea of having the regional vaping campaign with retailers? I know that was something that came up from the summer, and I don't know, and I know Giovanna, you and I talked about it a little bit, but
I was just, Margaret, you spoke and I was like, wait a minute, I did have something to say. So we are on the same brain wave.
so yeah, tell us.
So I wanted to talk to you. Margaret and I were talking about the whole, through mention prevention, a lot of folks are working with the retailers, and I know Kathy and Margaret were talking about what if the RBHAOs focused on more of the distributors and the state association. And we have a CPN, a Connecticut Prevention Network meeting this coming Monday to talk about that. And I have already asked to be put on the agenda to talk about it. And the president of CPN is really excited that that you guys all have thought of that, because she thought that it would be a nice initiative for the RBHAOs. So moving forward, I think that's what we will be doing, is working with the distributors and the state association to really focus on how and what we could do that would complement what you all are doing at a local level. Kathy, your hair is just fantastic today. So that's the update for at least a statewide initiative. But I was approached by FCCF, Fairfield County Community Foundation, and potentially we may be applying for a grant, a long-term grant that's really focused on working with youth, or at least enhancing the initiatives that you all are already doing. This is not set in stone yet, but with these dollars, if we do receive this grant, we will be engaging with all of you in how we could gather or get our youth from each town together to share initiatives and what you all are doing at the ground level. And hopefully be able, with that sharing, we'll be able to help other towns that are kind of struggling with how to get the ball moving, along with other things where potentially maybe have a region-wide campaign with the same message that all of the youth can utilize, where through this grant we would be able to pay for the marketing of the campaign. So crossing fingers, we shall see. I had to submit an informal proposal.
Ivana, I have a quick question for you. When you're talking about working through the distributors, I know I've seen emails about working with the distributors around liquor, liquor messaging. What has been proposed around vaping?
That's going to be the conversation I'm going to have on Monday.
Yeah. Okay.
Yes.
Thank you.
It's so I think Margaret and I just talked about it last week.
Yeah, but we were actually talking about alcohol.
Okay.
It was about, and Melissa, it was literally about the mention prevention type campaign. And in Norwalk, when we started rolling that out, they're like, why aren't you guys working directly with the distributors on something like that? And then Giovanna and I were like, we should go up to the CPN level for that. But Giovanna, if there was a way to do something like that similarly for vaping, that would be great.
That's my conversation. It's going to be for both, because mention prevention is vaping and alcohol. Right. So I'm going to see what CPN wants to do, and whether or not we do both, or we do vaping or alcohol.
Well, to this point, mention prevention hasn't developed anything for vaping retailers. It was an alcohol retailer campaign, but it could easily be adapted. So the mention prevention campaign originally came out of the changes in the alcohol sales laws and practices, you know, curbside pickup and people putting alcohol in your trunk and delivering to home. So that's where that came from. But certainly there is an element to the same challenges around checking ID and because people are wearing masks. And so I could see it could easily be adapted. So it seems like a logical next step, but nothing is in place at the moment to talk specifically about vaping. It's very much about alcohol materials.
You know, yesterday Melissa and I were talking, and I think part of what is appealing to us about mention prevention, not only because it kind of rolls off the tongue, but that, you know, it is generic, right? So we can move this in a lot of different areas and hopefully get recognition for it, and not just, you know, all these different substance specific, you know, images and messages. And, you know, maybe there's a way that we can tighten this up for a more, I guess, a tighter brand messaging around prevention.
Through this FCCF grant as well, I mentioned how potentially we could purchase mention prevention, a toolkit and all that comes with it, and be able then to potentially give it out to a coalition that may want to do it but doesn't have the funds to do it. Or we may have a mini grant of some sort so that you can apply for dollars to work on a vaping initiative, where then you can purchase that mention prevention piece. So it's all up in the air right now. Unfortunately, I wish I had some concrete or positive good news that we got the grant, but literally we're in beginning stages. But I will let you know about CPN and what is discussed after that meeting.
On it last, I think at the last meeting you had, I can't remember who it was that was working on trying to get Walgreens to stop carrying vape products. And I think you were probably waiting for Caitlin to get here and be the vaping person to kind of coordinate that message. But I don't even remember who it was, right? Like, do we have any update on that? Or is that something we can start bringing into our towns?
That was
Daniela
me,
had the
actually. Yes. And so I started looking into that, and I think it would be something that would actually be successful, because if you go to their website and say you search vaping, it comes up with, you know, tobacco cessation and all that stuff. And so I was doing more research, and I saw the Truth Initiative is actually working towards getting all Walgreens to stop. So I've reached out to them, but I haven't heard anything back. I can, you know, follow up with them, but I've tried calling, I've sent emails, but it looks like they've started to kind of bring it to everyone's attention, and they're trying to get youth involved to, you know, get the word out and things like that. So I think that would also be a great thing, and to show them, you know, CVS was able to do it and it did not affect, you know, their overall sales and things like that. So I can follow up on that and see what the next steps would be, but yeah.
Daniela, did you by any chance finalize, is Walgreens in every single town? All 14?
Not all 14.
I don't have an answer
Oh,
for that.
sorry, Siri. Not all 14, but I did make a list, and there was a very good amount. I want to say there was more than 20 Walgreens in total.
Weston doesn't even have a pharmacy, so.
Yes, but like the bigger places like Bridgeport, I think
Yeah.
have like 8 to 10 Walgreens or something like that.
Mm-hmm.
Yeah.
Yeah. I can't hear you.
Just saw Ina's like eyes go up like she was mentally counting Walgreens. Is that what you were doing? Because that's what I was doing for Norwalk.
Yeah, and it's difficult because it's not like we can go into any Walgreens and talk with the representative there or the manager or anyone, right? They're like, well, you got to take it to corporate, just like what CVS says all the time. Take it to corporate, take it to corporate. And then you don't have, nobody calls you back, or, you know, you're in limbo and they don't want to disclose anything. And it can be very frustrating. But it was nice to see that Truth Initiative already started that conversation with Walgreens. And I think that's maybe in where we can reach out to Truth Initiative and see where they are at, right? And how can we on a ground level be able to assist.
But at the same time, Giovanna, I think there is strength and purpose in approaching your local stores because it puts the issue on their radar that people care about this.
Mhm.
Even though they may not have the power necessarily to act on it. Who knows? That might, be dropped at a staff meeting somewhere. I had this group of teens and they're on my case about these flavored tobacco products. Do we really need to be selling this stuff? You never know.
No, you're right. Absolutely.
Okay, anything else on that topic? All right, let's move on to Narcan and the SOAR application for 2021. Is anyone doing any upcoming Narcan trainings or any other initiatives to prevent opioid usage in their towns?
One thing, our Trumbull High School health staff found a video and curriculum piece called If They Had Known. It's about a young college student who died from mixing prescription drugs and alcohol, so died at a party. It's pretty effective, and the health staff love it because it comes with a discussion guide and a whole curriculum piece, and they are doing a COVID special. So we got unlimited licenses for $150, which is normally they charge $1,200 for that. So I've seen it. I've watched it with my own college student daughter. It's pretty impactful. It's tough, but it's definitely something, especially if you have limited money and school staff who are looking for something. We've been really impressed with it, and the feedback has been really positive. But also because we have unlimited licenses, we can post it for parents. We can put it on, our websites and things.
Just to chime in and second that, we did an event with If They Had Known in Darien the day before everything shut down with COVID in March. That was eventful. But we've gotten the same feedback as Melissa. Parents and students really, really responded to it. And it's such a great opportunity right now with that deal they're offering. So just want to co-sign that.
And Melissa, they're just asking if you can share
Yeah, I'll see if I
a
can.
link or resource. That would be wonderful.
I will, yes.
Well, it's not in the future, but Giovanna did a Narcan training for us in Stratford, and we had Tuesday night, we had 10 participants, I believe it was. So 11. So we're pretty, we were pleased with that turnout. I mean, we've done live Narcan trainings with less people than that, so.
Yes. And for everyone, we do still have Narcan kits available with the black bags and other swag stuff that we have been giving out to any of the participants. Now that we have Caitlin on board, she will be our lead Narcan trainer for the region. So if you're not a trainer or you're just, the capacity within yourself is not, you cannot do the training, Caitlin will be able to help. And then of course, myself and Daniela are trained as well. So we will be able to help as well.
So I just had a question about the survey that was going out for the Narcan trainings and how that interacts with the SOR grant. And so if we were applying for that SOR grant and said we were going to do Narcan trainings, would those Narcan trainings that Caitlin is offering count toward that SOR grant to fulfill that deliverable?
Yes. So any Narcan training that you're doing within your town, that counts as an event where you have the DMIS code to utilize. Caitlin is going to also not only be able to assist you all in being that trainer, but also she has the flyer all ready for you. She has the Narcan PowerPoint. She'll have all of the swag where you don't have to do anything. And then she's also going to be having, doing regional trainings as well. So Caitlin, you can talk a little bit about that.
Yeah, sure. Is it okay if I screen share to show the flyer? Okay, can you all see this? Can you all see the flyer?
Yes.
Okay, so yes, so we're hoping to hold weekly virtual Narcan trainings. They will be free. They're open to anybody. Every participant who comes also gets a free Narcan nasal kit. It's pretty simple. This is the working flyer. We're just waiting to choose on a day of the week that works best for participants who are interested, as well as the time. And so that is what's going to bring me to the survey, which I'll talk about in just a second. But just to give you an idea of what our Narcan trainings are going to cover, we're going to cover the opioid epidemic, how to prevent an overdose, how to recognize warning signs and symptoms, how to administer Narcan, current protective legislation in Connecticut, and then local resources and services. And again, every participant who comes to the virtual Narcan training will get the free Narcan kit, which Giovanna is pretty much almost done with the process and how we are going to safely distribute those to our communities. That's my contact info. I am the contact person for any Narcan trainings. We can also offer it to specific groups and organizations. And then I guess let me talk about the survey. So I did email everyone here the Narcan survey that I've been working on. So with all our hopes for Narcan trainings this year, one challenge that did come to mind to me was really making sure that we were presenting Narcan trainings at times that was most accessible and convenient for anyone who's interested, who wanted to participate, to really up those numbers of participants who come to the virtual Narcan trainings. So with this question, I just created the really simple survey that I emailed all of you. And is it okay if I also put the links in the chat? That's okay. Okay. So if I would like for everyone here to take a few moments to take a look at that survey. It's in your email. I'll also put it in the chat right now. But you just open it up, and then based on your experience or your interest, to fill out the survey for what day of the week you think is best, and what time during the day you think is best. We're also, well, I'm thinking about switching it depending on the month or whatever it might be, but it's just really important information to try to get as many people to our training as possible. It can also be shared, so I encourage you all to share it if possible with anyone who might be interested.
Yeah, so we all, within our own community, we know what days work best, what times work best for not only our coalition members to attend something, but also our community at large, right? And so when you're doing this, completing the survey, that's what you want to keep in mind. It's not just about you. You guys already have Narcan at your tips. You can get it at any point because you all have been trained before. But this is more for the community at large.
Right. It's really simple, just really asking our communities and communities at large for their feedback. And what we'll gain from this survey is definitely what we will put as the day and time. Like I said, those might alternate depending on the week or the month. So yes, there's two separate doodle surveys. So the first one asks you the day. It's in your email. You can also copy and paste it. So you'll see doodle survey number 1 and then the link at the bottom. And then doodle survey number 2, the link at the bottom that asks for what time of the day, just the general time of the day to get a good idea.
So I want to go back to the question. So that, I guess Ellen was kind enough to ask. So is it that if we promote your weekly Narcan trainings in our community, members of our community attend, then you then that would count as our deliverable for SOAR.
No.
Or you want us to do training, you want us still to do our training and promote your training. Okay.
Yes.
That's what I'm a little concerned about, just because sometimes it's really hard for us to even do one training in our town and get people to come. So if we're promoting your training and then we're also trying to sponsor our own training, I think that's going to be tough.
Well, so when we're doing this, it's about promoting, giving people options, right? So you may have a scheduled event for your community to do the training, but what if they can't attend? So you're giving them other options so that they know, well, if you can't come to ours that is through us, you have other different options. So that's really it. So if people come, if you promote it and people don't show up, you post it on your social media account. You're not doing anything but just forwarding it. Does that make sense?
I think so. I don't know. I think I'm so confused. Sorry.
Talk to me.
It's
Tell
Friday.
me.
It's hard.
I know. Believe me.
I guess I'm feeling like if we try to offer one in Greenwich through our SOR grant, let's just say, couldn't that be the same as the one Caitlin's going to offer in our community? Or do you want it to be different?
It has to, per SOR and what the deliverable is, in order for you to check that box of it, you have to be the host. We're going to be the host of the training, the flyer that she's going to create based on different dates. The different dates, that flyer is going to be going to treatment providers, prevention people, community at large, senior centers, libraries, you name it. That's something separate of her job that she has to do. So if you promote that flyer, great. We want you to, but if you don't want to, if you don't have to, then I can't tell you not to, or I can't tell you you can, but the whole point is to share it so that just in case.
Okay. Yeah, that makes sense. And then Caitlin, though, can do if we are sponsoring one, like Greenwich Together is going to sponsor one for Greenwich, we can use you guys, Caitlin, and to do that training.
Absolutely.
Okay.
Yes. So that's why I said in the beginning, she will be the person that will be the trainer for you guys because Ellen, you're a trainer, but the capacity, you may not have the capacity, right? She will be able to do the training for Greenwich Together, just like Riney, Fairfield Cares, and anybody else that I know. Melissa uses somebody else, so she wouldn't even utilize our services. These are just services that we are providing to you all for free because you are our LPC.
Okay, got it.
Makes sense now? I'm sorry. I'm sorry if I wasn't clear enough. My apologies. I'm going on probably 4 hours of sleep at this point.
So question, if one question is, Caitlin, do you do Narcan trainings in Spanish? And yeah, I don't know.
I personally don't do the Narcan trainings in Spanish, but I've spoken to Giovanna about this, and we do have a team of Spanish speakers who are trained in the Narcan trainings to be able to.
You're looking at her. Margaret is one of those Spanish-speaking trainers.
Okay, well, I figure it was worth asking because always good to have somebody else in the mix. And so what it sounds like, if I get it, like from the survey, because I haven't answered your survey yet, Caitlin, because I'm like, if it's aimed at the community, almost anytime really, we're going to promote it, right? So it sounds like to me, if you just pick a structured schedule, is the idea going to be you'll have like a daytime one week and then 2 weeks later you'll have a nighttime one, something like that. If that's going to be a standard schedule, as soon as you get that out, then I'm happy to then we can just make sure maybe in our communities that we schedule our own at different times and days. And that way it really is options for everyone. So it's almost like if Riastab Hub wants to set a schedule, then we just work around it, and then people have lots of options.
Yes, I'm glad you said that. Oh, I'm sorry, go ahead.
Yeah, I was just gonna say, I have some concerns about multiple flyers, promotions going around our community with coming from what looks like different places about the same thing. Like if you're going to libraries and I'm going to the library in Trumbull and we're like, it's all gonna get like kind of lost in the shuffle. Like I agree with Margaret, like promoting all of them in kind of one place would probably be more helpful. Like, hey, I might want this. Oh, here are all my options. But if I get a flyer from RISEP and I get a flyer from Teapot, I just feel like it's gonna muddy the waters a lot. That's my take.
So what my vision was, or is, Caitlin's job is to make sure that she gets out as many Narcan trainings on our end as possible, because we have over 700 kits, okay? So that is her job, that besides assisting you all in your Narcan trainings, she's going to she created the flyer, she's going to set a day, dates and times every single month, and potentially maybe the same, so that they're recurring, right? Recurring Narcan trainings to push out these kits to the community at large. Now, once you all have, and if you apply for the SOR or not, doesn't matter, you know you still are able to utilize our kits, whether under contract or not. What we were going to do was also share your information. So we're still getting out the same information. Now, some of you may not want to use our flyer, and that's fine, because if you're hosting something, you want your logo, you want your marketing colors and things like that. So you may not want our flyer, which is totally fine. You can do that. But this is, again, where the capacity comes into play for maybe Sonia or maybe Tammy Julian, where you can use our flyer. It's already made, and why create something else?
So RISEP, we've been doing these Narcan trainings for years, right? So now we typically in Trumbull do ours at night. So we typically get residents, but then occasionally we'll get some people who want the information for their jobs because of whatever they do. I mean, if you guys are able to kind of do more of the daytime ones that focus on, how much have we targeted, like the healthcare providers, the treatment people, the community, not necessarily the community residents, but like people who, might have clusters of people who want this information, whether it's, people who work at a community center, like working through the town employees. We've never, I've never offered it to town, we've offered it broadly to town employees at night, but then it's like outside of their normal duties, right? And outside of their normal work hours. Has RISEP approached any towns or municipalities about offering it during in services?
Yes, we have done it in the past.
Okay.
Yes, Norwalk, we have done professional development for nurses, for social workers. We've done, not senior centers. We have done senior
library
centers.
Staff too, haven't you?
Library staff we have done in the past. Shelters we have done. So there are specific entities. And from Caitlin's email that she sent out to the community at large separately, they've already reached out to her to do organization trainings as well.
Great, because even if you went through YMCAs and or churches, bigger churches, there's an opportunity there that I think we're not cannibalizing each other. I don't want to run 3 Narcan trainings and 2 people go to each for the community when we're just kind of, as I said, I don't want to cannibalize each other. So
no,
I agree. So I wanted to go back to what Margaret had mentioned, is that if we could have a set schedule. So I did send out a mass email to all different settings of the community at large. We've mentioned shelters, we included firefighters, EMTs, providers, everyone just in our area. So I do agree that if maybe I could target the communities at large and the areas that maybe it's not being focused on, and then all of us come together to focus on your regions, then we're really reaching as many people as possible. And Margaret mentioned maybe we should stick to a set schedule. And I really like that idea, because I think with that, we're able to all have kind of the same chances of getting volunteers and participants. And I had mentioned an alternating schedule, because when I sent out that mass email, I was already getting feedback of, hey, you know, we want Narcan trainings. Can you do it at an alternating schedule so there's more chances? So there are a lot of people that want Narcan trainings. And I think it's great that we're discussing it, because now we're coming together and we can really say who's going to take over what role primarily. And I'm just here as the support. And Giovanna mentioned we can also circulate your resources, your flyers. Feel free to use my flyer. I just really think that this discussion's been really great and helpful for me and for all of us. So thank you all for your feedback.
Hi, Riley here. I'd like to add a few cents as well. I really think the more options there are, the better. If we have one person attend a Narcan training and that one person happens to be able to save life, we've done our job. And so I'm really all about options, and I would love to be able, like, if there's a running calendar of all the Narcan trainings in the region, that could be whenever somebody publicizes a Narcan training. If this date doesn't work for you, look at the current calendar. Especially now, right now they're virtual. It's not so difficult to travel to places, and I am totally open to everything. So I'm on the opposite spectrum of other people here. And my trouble is because the Narcan trainings we've done some for people in the hospitality industry, and the Chamber of Commerce has done one. And so we're trying to hit different constituencies. But I feel where we have really trouble is reaching parents whose kids are experimenting and going down a difficult path, because they all think it's not going to be them, and it's not their problem, and they don't have to deal with it. So that reach, I think, is really difficult. And what I've seen is, the Narcan trainings in person oftentimes attracted what to me seems like Narcan tourists that go to different Narcan trainings to then get some kits and have them on hand for, like, en masse, because they might have need for that, because it helps them sustain a habit. So it's an interesting thing, but like I said, I'm not feeling that we would be cannibalizing each other at all.
And the same thing that we have done in the past too, right, with our calendar on our website. The events that you guys have, we try our hardest to put them on the calendar so that it's connected to our website. Anybody that goes onto our website is looking for a Narcan training, it's all going to be in there. They do the search and they search Narcan, and all of your trainings should be popping up, so that there is a plethora of trainings that they can choose from, depending on what their availability is. So that's eventually where all of that stuff is going to congregate to, so that there is those random folks that stumbled upon the Hub's website because they're struggling with a loved one or struggling themselves, and they want to get Narcan, and they do a Google search Narcan, and our information pops up. So that's the hope and the goal, of course, is to get this information out there.
Giovanna, can I ask a question that's not Narcan related, but SOAR related?
Sure.
Okay. Ryan and I were...
Righty, Kathy. Take it easy on me.
So Ryan and I were chatting about how we might use the funds. And one thing we would love to do, so we wanted to find out whether we could use the funds for this, is to purchase banners, for the lampposts, that you see in town. So not a given, 4x7 banner for a town green, but banners that would be hanging by lampposts. So as you go down the street, you see these messages, one right after the other. Would we use our funds to purchase banners that would provide, obviously, a prevention message, And we were thinking of trying to get them hung in connection with International Opioid Overdose Awareness Day in August. So we would, you know, have these hung and have an event related to it. Would that be okay?
Yep, as long as the message is about opioids, overdose, it could be about live loud, it could be about change of script, all that stuff, then yes.
Okay.
You can utilize those dollars because that's information dissemination, right? So that's a code that we can utilize.
Okay, terrific. All right, cool. Thank you.
I had one more comment, and I don't know if Giovanna, you would, what are your thoughts on this? But for all of you who have the survey now, you're hosting your own trainings, you choose times and dates that are not your training, so that way we know that we can be mindful that trainings don't conflict or anything.
The little one escaped.
Escaped, he came down the stairs. But yeah, what are your thoughts on that?
So can you ask that question again, please?
Sure, sorry. I was saying that what are your thoughts on if you have the survey, you have my survey and information for my trainings, and you have your own Narcan trainings that are happening, you can choose times and dates that work for your community when you're not presenting your Narcan trainings. That way we can work around your dates and times so that there's more options for individuals, but also we know not to give those Narcan trainings during your times.
So in Caitlin, in my past experience with all of the local prevention councils here, they typically will do 1 to 2 trainings in the SOAR contract time frame. So they're not going to be doing these trainings like you are going to be doing them, consistent, recurring. So I would suggest, and please, if everyone agrees, then that's what we'll do and we'll move forward. But I suggest that you choose those dates and times and have them recurring for the next several months. And then everyone here, when and if they are doing a Narcan training, they'll work around those dates. How does everyone think about that?
Good. I think that's a good idea.
Okay.
I think that works.
Quick question about the Narcan trainings that you guys are doing, or even the ones in the SOAR. Well, the SOAR grant mentions QPR again, but for the Narcan training, all right, go Giovanna, tell us. Are the Narcan trainings all going to be including a suicide component?
Yes.
Yes.
I gotta. So of course I gotta choose my words wisely, of course, because Demas is expecting that we do some type of QPR training within the Narcan training. Now, ain't nobody got time for 3-hour training on Narcan. We're not doing it. However, we are going to include some slides from QPR, or at least a couple of slides that incorporate suicide and the correlation between suicide and overdoses. So yes, there is going to be some of that. And that's the only workaround I have. That's my saving grace right there, that if Demas comes back and yells at me, I can say, oh, we did have 5 slides. What are you talking about?
So Giovanna, last time, and I think Margaret, you were still at the hub at this point, you had said that we could also do the Talk Save Lives. So it didn't have to necessarily be QPR, but it had to be some sort of suicide prevention piece or suicide awareness piece, because the Talk Save Lives is shorter. So I just throw that out there.
Yes, depending on your audience, yes, it is shorter. I just did a Talk Save Slides training this morning before attending this meeting, and it took me about an hour and 15 minutes, and I talked about senior population in COVID. So it depends. It depends on your audience and what the level of information they know about suicide, right? Because you can get into those risk factors, those protective factors, but then also identifying and giving examples of what each one is, and it can go on and on and on. But for now, we do have a couple of slides with just suicide. And yes, if you all want to do a Narcan training and attach a suicide prevention curriculum, yes, we can do that. Absolutely. If you don't want it, if you want it in the same time frame, same training, we can do that. If you want to do it where you do the Narcan training and pause for about 5-10 minutes for a little break and then get into the suicide prevention, we can do that as well.
And one thing, when Melanie and I were both at the hub, but this was pre-COVID, right? But we had a pretty good system down where we would offer a 2-hour training called How to Save a Life. And it would be an hour and a half QPR and a half-hour Narcan. And we could do it. We could do the full thing in 2 hours, including the role play for QPR. But when people signed up, they could say, I want to do the first part or the second part or both. And so it didn't feel quite as overwhelming. They didn't feel like they had to sign up for all of it. And then almost all of them did all of it. So I don't know. I mean, suicide is obviously a huge concern right now, right? It's worse than ever. But that still doesn't mean people want to go to a training around suicide. So this is my question related to the SOR grant, or just generally. I saw that the second deliverable of the required deliverables just sounded really general. It said, do substance use prevention or behavioral health initiatives, right?
Yep.
So that could be kind of, we can use that for something, whatever we want to use it for.
Yes, so it would be, but again, it has to have something that is related to opioids and overdoses. So if you wanted to do something on mental health, COVID, and the increase in substance use. Exactly, that includes potentially alcohol, alcohol, and experimenting with opioids or any type of pill substance, that can be all included, yes.
Yeah, okay, good. Because I'm thinking like maybe it's something like coping with crisis, or, you know, and you insert a little bit of all of those, and instead of like an official suicide piece, it's like, how do you handle this crisis and how do you not handle it? How about not drinking and drugging, and how about trying this, and know your crisis resources, and something like that.
Absolutely.
Okay, cool.
Even if you wanted to, you know, for a newsletter of some sort that you wanted to use some dollars to have someone create a piece on, I don't know, something that you're passionate about wanting to do, and you didn't have those dollars, you can use the SOAR dollars as long as you have the word opioid, check. And you guys all know I'm pretty flexible when it comes to these grants, and I'm open. I understand to be restricted just on opioids is crazy. We do so many other things that there's always justification in my eyes, and I'm a rule follower. But there are sometimes we have to do what's best for our community, and not for us, our community, right? What we see there's a need for. And again, if you want to do something and it says opioids, or you have the Change the Script logo and you're doing something on a presentation on marijuana, and you do Change the Script logo or a Live Loud logo, boom, you can pay for that presenter. A marijuana presenter under the SOAR.
So I have a question. We've been asked by a family in our town who lost their son, adult son, to overdose death from a counterfeit medication he bought. died of a fentanyl overdose, thought he was buying Xanax. Have you seen any campaigns around or anything already existing around the kind of counterfeit prescription medication problem? Anybody?
I feel like I have seen something.
Margaret's talking, but we can't hear her.
Oh.
Not muted. Can you hear me a little bit?
Yeah, yeah.
There is one counterfeit drug campaign that I found. Remember when we had the high intensity drug guys come and talk last year about counterfeit? And I went and tried to really research campaigns, and I only found one real one out there. So I know I sent it to all the LPCs then. I have found it since. I can't remember what it is, but I will try to forward it.
Thank you.
It's
I'll go dig
not
through.
extensive, but there's some videos and things. Riney probably knows what it is. I'm looking at her. She's going to find it first.
She's
good like that.
Guru. She's the best.
And I don't delete any emails, so I'll go back and see if I can find something. I don't want to recreate the wheel if I don't have to.
So I have two questions. Oh,
Just
sorry.
so you know, we had that drug. This is stuff that I'm supposed to file eventually in my lifetime. We had that drug trend HIDA come in on February 28, 20. Just so you guys know. If that helps trying to find that
so
email.
Exactly. Look for an email from me from my hub address within 2 days of that. And then send it to us.
I will.
So Giovanna, the deadline for the SOR grant application is the end of this month, right? I think.
Yes.
When do we think that the actual date the start date for that grant will be?
January 1st.
Oh, it's going to be retroactive. I love this. I love how they do it. They drive you
Tammy,
crazy.
you're done. You don't have to do it. And Tammy Trojanowski, you don't have to do a Narcan training.
Holy cow.
Lucky.
Wow. Okay.
Yes,
That's good.
January 1st.
Till September.
Yes,
Okay.
to the end of
And then
September.
my other question was, what was it? Now I'm lost it. Oh, about the prescription drug monitoring program. I know that's in there as a potential one you could pick to, I don't know, we struggle with that. I remember even when I was in New Canaan, we struggled with how to promote that, if you're talking to Demas and they want recommendations, I would say if they could do something on a regional level with that prescription drug monitoring program, I don't know. I'm just putting it out
I have
there.
contact with the with that unit, and I think they struggle with it, to be really honest. There's been a lot of changes in the person that really oversees who is supposed to sign up for it. The number of, I don't even want to throw out a number, but it was alarming to me that we've years that these people that are prescribers should be have signed up for this program, and they're still not signed up.
Right.
Not everyone is signed up in Connecticut.
And where's the oversight on that? Like, who's doing that?
Exactly.
And why? And how could we be using these $5,000 to do that? Like, it doesn't make a lot of sense to me.
Monday afternoon, I have a prevention subcommittee meeting, state level, which that gentleman attends those meetings. So I am going to bring up that now, knowing that SOAR is on our agenda.
Okay, thanks.
But I agree. I saw that deliverable and I was like, oh, really? Like, what do you want to do with this? You can only send out so many letters that probably get kicked back anyways. Any other questions? Caitlin, did you have anything to add?
No, that's everything. If anyone was interested in circulating the survey, we're planning to close it by tonight. It's a short survey. We had it open for a little while, but yeah, that's everything. But thank you all for listening, for helping, and for supporting. I appreciate it.
And thank you, Caitlin. And Riney just put in the chat box the link to Pfizer's counterfeit awareness campaign.
You're awesome, Riney.
But
I need
I
your
don't think
skills.
that's the one that was changed. Was that the meth campaign that Montana did? That I found that, but that's also different.
Mm,
I think we'll take whatever you can find.
yeah, seriously. And what else is on the agenda, Daniela?
The priority report, regional priorities and data.
I need you all. I need all of you. So priority report is full. Well, we haven't really started, but we will be starting very soon. Priority report will be due at the end of June to DEMIS. It's the same. It's the report that Margaret and I did back in, completed it back in June 2019. So we are now in the process of going to be compiling information and hopefully creating some of those subcommittees again, the data subcommittee group. And then I was hoping to have the priority ranking done for you today, but unfortunately taking off 2 weeks set me back for I don't know how many months, because I just can't catch a break. At least this week I couldn't catch a break. But what I'm hoping is that I'll be reaching out to all of you to really get a ranking, a priority ranking on substances for our region, and what you feel within your own community you see fit that we really need to focus our efforts on. And hopefully DEMIS will see that and change what we do at a local prevention level and gathering different initiatives instead of maybe just one being vaping in capacity, even though I do understand why they are doing it and how having the same message across the state will reduce, hopefully reduce the use in vaping amongst youth from 12 to 18 years old. So that is to be continued, but just so you know that that's on my brain and my shoulders, and Daniela knows I itch when I start thinking about it, but we're finalizing the developing document now with CPIS, so hopefully I'll have something out there for all of you. What I'm really hoping for, and this is where I will need all of you, is to really compile or send us some data information within your towns. Now we took the data, the youth data, and anything else that we were able to gather the last time and be able to compile it, but then be able to compare towns, and we didn't do that and disclose each of your towns just to protect everybody, but we wanted to, we need to tell a story of our region and what that story looks like, whether, you know, we have some good and we have some bad things in our region that we can definitely work on, and I look forward to telling that story again through all of you, of course, with your help. So hopefully we'll have a smooth process. I doubt it, but I'm helping.
You know, I know that you are under pressure to provide this data, but you know, now is not, I mean, we had to do a survey just to be in compliance, but I have to tell you, we don't think it's ethical to release the information because we don't think it's a smaller sample, and look at the world. I mean, we just feel like it would be irresponsible to release it. So I think
that's something that
we need to be aware of that right now.
And that's something that I'm putting in the report. Absolutely. That many of the towns did do a survey, but it wasn't a survey that they're going to utilize and set their goals for next year, right? This is just to suffice a grant deliverable that's required. But I will be saying something along that line where, of course, I'm not going to be calling out any specific town, but it will be said in the report. So I will, and maybe in 2 weeks, maybe that's when I will do the priority ranking and kind of talk to you all to see how you're doing. I'm not really too sure. I just went through a CATCA training, COVID and coalition building, capacity building. Did anybody else attend? Dina attended. Melissa, Dina attended.
Was that the one? Was that the one that was this week? Was that
Yes.
the Spiff Sig and and COVID? It was awesome. It was great.
It was awesome. It was so good. I got off of that thing and I said, damn, I'm sorry. I was thinking to myself, I'm like, I feel so distant from all of you, and I've known you guys for so long, right? Several years, and the connection, and that's why I'm questioning whether I'm going to do the check-in with all of you, or maybe do one-on-ones to just say hi, see how it's going, be more personable instead of constantly being in groups and just seeing small boxes across. And I appreciate seeing all of your beautiful faces, but I'm like, we don't have that one-on-one relationship right now, which I miss, sadly, and I miss. So, but after that training, oh man, I loved it. I loved everything about it. So that's where I'm starting to think about whether or not I'm going to do the thing. But with that said, we'll see about the priority ranking and when I'm going to do it. But just keep in mind that if I do reach out to you, please, if you can help in any way, that would be wonderful. Anything else? Daniela, where are you? There you go.
Hi. Nope, just I hope everyone was able to get the attachment of the permanent list of upcoming awareness days, just to have in mind for the year. That's all.
Okay, there's nothing else.
Thanks, everybody. Good to see everybody. Happy New
Bye,
Year.
Good to see
Thank you.
everyone.
Thank you.
Happy
Thanks
New
for your
Year.
time.
Happy New Year.
Yep. Take care,
See you
everyone.
soon.
Bye. Have a good weekend.